information before we begin, I want to set out a few points. This meeting will be held in a hybrid format with some members in the Senedd chambers and others joining by video conference. All members participating in proceedings of the Senedd, wherever they are, will be treated equally. A plenary meeting held using video conference in accordance with the standing orders of the Welsh Parliament constitutes Senedd proceedings for the purposes of the Government of Wales Act 2006. Some of the provisions of Standing Order 34 will apply for today's meeting, and these are noted on your agenda. And I would remind members that standing orders relating to order in plenary meetings apply to this meeting and apply equally to members in the chamber as to those joining virtually. The first item this afternoon is questions to the First Minister, and the first question is from John Griffiths.
What is the Welsh Government's latest analysis of COVID-19 incidents in Newport East?
So I thank John Griffiths for that question. The Newport East constituency, as many areas of Wales, has seen a high incidence of coronavirus infection. A national fire break was introduced to bring rates of incidents down across Wales. Some of the gains achieved are already being reversed in the post-fire break period.
First Minister, I think there is concern at the latest statistics, and obviously we will need to have a look at that. Welsh Government will need to have a close look at that. One aspect that's very concerning to my constituents is lost school time. In secondary schools, for example, whole year groups continue to self-isolate when one of the group has COVID-19, and learning at home does not make up for that lost time. And it is the most vulnerable who suffer the most. Practice seems to be different from one school and one local authority to another. So, First Minister, will Welsh Government work with local authorities, schools and unions to seek to reduce that lost school time? For example, looking at safety in schools, limiting contact between pupils so fewer have to isolate when one has the virus, and enhanced testing at schools to limit the damage to our children's education and the nation's future.
Well, let me thank John Griffiths for that. And of course, I agree with him. The fact that we are seeing a reversal of some of the gains that we achieved through the fire break is concerning. And it is particularly concerning because we know that the higher the incidence of coronavirus in the community, the greater the impact that has on schools, because the more coronavirus there is about, the more likely it is that adults will find themselves infected and children as well. Now, it is right that local authorities and indeed head teachers and governing bodies have some flexibility to be able to respond to local circumstances, but nevertheless, it is also a concern that there appears to be a disparity between the way in which some schools organise themselves to prevent the need for whole year groups to be isolated, and different levels of risk are acceptable in different schools in Wales. Now, the Welsh Government has done a great deal already to make sure that frontline staff and people who are in charge of schools have access to advice through their local incident management teams, through Public Health Wales, to try to get a more common understanding of the way in which these risks can be mitigated. It is possible, Llywydd, that the new lateral flow tests, with their more immediate results, can be deployed in schools in future in another effort to prevent children from having to self-isolate when things could be done to prevent that from happening, for all the reasons that John Griffiths set out, which are the same set of reasons, Llywydd, why the Welsh Government has placed a priority on making sure that our children's education is protected even at this most challenging time.
Laura Ann Jones.
Thank you, First Minister. Following on from John Griffiths' question, I'd like to say that I've also been contacted by a number of worried parents in the Newport constituency area because currently, as it stands, there are 1,000 people isolating from Cullion Comprehensive School, my old school. Years 7, 8, 9, 12 and 13 are all off at the moment, which is beyond comprehension, really. Obviously, year groups have to stay off if there are enough cases and there's a reason to stay off. But there are other schools in other counties with just one case, as in the case in these year groups being off, where they just do the track and trace, like in Monmouthshire County Council, and just keep 15 pupils off rather than whole year groups. I mean, parents are obviously very concerned at this because obviously it affects their jobs, it affects the children's well-being, mental health and their education, obviously. So I'd be really appreciative if you could do all you can, maybe firm up the government guidelines to school, because at the moment, as you said, there is a massive postcode lottery to education right now happening in Wales. And also, whilst you're at it, if you could also, you've said to schools recently about wearing masks, that you can wear them if you want to. Maybe government guidelines should be stronger. So there's consistency right across the board in Wales in our schools. It's very confusing for them. Thank you.
Well, so I think the guidance on mask wearing in schools has been strengthened just in the last week, and the Education Minister providing more direction to schools, particularly secondary schools, as to how masks can be worn in corridors and in other crowded settings. But I share a lot of the concerns of the member's question, that different decisions are being made in different parts of Wales. Despite the strengthened assistance that the Welsh Government has mobilised so that head teachers and others can have advice directly from public health expertise in reaching the very difficult and challenging decisions that they make. I don't minimise the challenge that schools face. There is a correlation between the extent to which coronavirus is in circulation in any community and the impact on schools, and that helps to explain some of the difference. But it doesn't, in my mind, explain it all. I am very keen that schools make every effort, both in the way they organise themselves internally and in the decisions that they make, to put a priority on keeping as many young people in schools as it is safe to do, because otherwise, as John Griffiths said in his question, their education suffers, and those who need that assistance the most miss it the most when it's not available to them.
Question 2, Mike Hedges.
Diolch, Flowers. Will the First Minister produce a roadmap for the return of amateur team sports in Wales?
Well, the Welsh Government has published guidance for a phased return of sporting activities. National governing bodies in Wales, such as the FAW and the WRU, provide specific guidance and action plans for their sports and have oversight of those organised activities.
I speak as someone who spends a lot of my Saturdays normally watching football and rugby, mainly local teams. Can I just talk about the two most popular winter team sports, football and rugby? When does the Welsh Government believe they can realistically expect to be able to commence competitive fixtures? And I also realise that football will be able to start before rugby because rugby has much more physical contact.
Well, I know that we all look forward, and I know Mike Hedges does in all the things that he does locally to support teams in the Swansea area. We all look forward to the day when those teams will be able to resume. We have established a national sports group through Sports Wales, bringing the Welsh Government, the governing bodies and others together to consider requests from the national governing bodies to allow competitive leagues to resume. The group will meet again tomorrow to consider the first batch of applications. The FAW has asked that Tier 2 of the Cymru leagues, that's North and South, should return to competition first. So we do have a mechanism now in Wales to unlock sports when it is safe to do so. And that final clause is the most important one of all, Llywydd, that it is the state of coronavirus, it is the state of the public health emergency, which has to be the lens through which we view all the applications that there are for the reopening of amateur sport. But we have a mechanism now to make sure that those requests are properly and roundly considered.
Nick Ramsey.
Diolch, Llywydd. First Minister, I was pleased to hear you just say that you're looking at ways to, I think the expression you used was unlock sports during this time of the pandemic. As we know, during lockdowns and fire breaks, physical activity and sport is all important. So in response to Mike Hedges' initial question, if I could follow up in two ways. First of all, what are you doing to make sure that younger people in particular are able to engage in sports at this time? They've been particularly hard hit. We know that younger people are affected by mental health issues in the same way that older people are too. And secondly, I had a recent meeting at Chepstow Racecourse in my constituency, and they were very concerned about when racecourses are going to be allowed to operate, at least in some limited fashion in the future. So I wonder if you could answer those two strands. Thank you.
Well, thank you, Claire, and thank Nick Ramsey for that. Sport for children under the age of 18 has a more liberal set of rules, and it's more possible for that to happen, and we've done our best to try and maximise the opportunity for youth sport to be continued even in the most difficult periods of coronavirus. As to racecourse reopening, there were, earlier in the year, as I know Nick Ramsey will know, a small number of pilot reopenings of race courses in England. We will work with DCMS at the UK government level in any programme of pilots which may now resume in England. We look carefully to see whether there was any virtue in having a Welsh pilot in the horse racing field, but the conclusion was we probably wouldn't learn anything very different that we could not learn from the pilots that were being conducted elsewhere. So we will continue to work closely with DCMS. There are some new pilots that are proposed, and if they find a pathway to the safe reopening of more parts of sporting life to crowds turning up who enjoy horse racing and other sports, then we will want to be part of that where it is safe for us to do so.
Cwestiwn yn nawr gan arweinwyr y pleidiau.
Questions from party leaders, Plaid Cymru leader Adam Price.
In what has been the toughest year in living memory for so many of us, I'm sure we all look forward to a happier new year and before then to spending time with friends and family over Christmas. A compassionate but responsible approach to a limited relaxation of restrictions over the holiday period seems sensible. However, it's also crucial that we don't lose the hard-gotten gains of the last few months for the sake of 4 or 5 days, and people must therefore know that any relaxation also comes with risks, especially in the context of the reversal that you were potentially referring to earlier. Can you say what scientific modelling is being used to inform the discussions on a four-nation approach to the Christmas period, and what's your understanding of the likely impact of any easing of restrictions? And given that individual behaviour will be a crucial factor in determining what follows the Christmas break, will the Welsh Government launch a public information campaign, such as the powerful campaigns we see each year on drink driving over the festive period, encouraging people to follow the guidelines so that we can all enjoy a better 2021?
Well, so I thank Adam Price for that, and I think he put it very well, that while for many people having an opportunity to meet with family and friends over the festive period is very important, we have to balance so many things in allowing that to happen. Now, there will be a COBRA meeting later this afternoon, which will be the latest coming together of the four nations of the United Kingdom to fashion a common approach to Christmas, and I'm very hopeful that we will be able to make further progress on that this afternoon. The modelling that we have available to us there comes through SAGE. When we met on Saturday, we specifically asked the 4 chief medical officers to meet between the Saturday meeting and the meeting later today to give us further advice on a number of aspects of a potential easing over Christmas that we rehearsed in the Saturday meeting, and that will be available to us this afternoon. But I agreed with the point that Adam Price made, that whatever additional freedom we are able to offer over the Christmas period, will have to be used responsibly by people. The fact that a relaxation is possible is not an instruction to go and spend the whole of that period doing risky things. The Leader of Plaid Cymru asked what the impact of any relaxation over Christmas would be. And while I don't have a quantifiable answer to that at the moment, the general answer is very clear. It will lead to more spreading of coronavirus, because coronavirus thrives when people get together, and the more people get together, the more coronavirus there will be. It's why, Llywydd, I have been arguing in the meetings we have had for a focus not just on a small number of days at Christmas itself, but the decisions we need to take in the lead up to Christmas and how we will deal with the aftermath, and to try to do that in a broadly common basis as well. And on the information campaign, the final question, then the Welsh Government has an information campaign planned, and it will do many of the things that Adam Price mentioned in trying to drive home to people the consequences of people's behaviour and the ways in which, by doing the right things, we can all make a contribution to having a Christmas that we can enjoy without running those undue risks.
On Saturday, Merthyr Tydfil became the first county in Wales to pilot mass testing, but on the same day, COVID cases per 100,000 of the population in a 7-day period were higher in Blaenau, Gwent and Neath Talbot. This highlights an inconsistency currently in the way we're dealing with areas of high COVID transmission. When we supported the fire break, it was on the condition that the test and trace system would be upgraded, accelerated, expanded to include the testing of asymptomatic individuals. Small independent nations, as we've referred to earlier, like Slovakia, have successfully rolled out a nationwide mass testing programme. China has been conducting mass testing of 3 cities over the weekend, and we'd like to see it rolled out in more target areas, supported by an increased £800 isolation payment. When, First Minister, will we be able to turn the Merthyr pilot into a wider programme of mass rapid testing in Wales?
Well, I think it's just important to remind members that when Merthyr was identified as the first place where we would carry out a mass testing experiment in Wales, it was, as it was for a number of days, by far the largest area of incidence of coronavirus. Others have overtaken it in the meantime, but in the planning, you've got to start with the figures that are in front of you on at that time. And I know there'll be a question later this afternoon, Llywydd, but just to say that the early days of the mass testing in Merthyr have gone very well and are a tribute to the actions of local organisations, but also citizens in that area. We will learn a lot from doing it. We can be sure of that. We're already learning things from these very early days. There are already proposals for expanding mass testing into other areas. There will be choices to be made, Llywydd, and they won't be easy choices either. I referred in my answer to the first question that we might be able to use lateral flow tests to assist in preventing children from being asked to self-isolate in the school setting. We've talked, I think, last week on the floor of the Senedd about using lateral flow devices to allow visits to care homes. And we could use lateral flow devices to have a greater scope of mass testing in Wales. But there is a finite number of them. We expect to have around 90,000 of them a day available to us here in Wales. But they would very soon be used up from a number of the purposes that I've just outlined. So it'll be a balancing act. It'll be trying to prioritise where we use them. There will be some more opportunities for further mass testing, but there will be other important purposes for which that finite supply of such tests can also be deployed in Wales.
Turning to matters vaccine-related, where we've had some further good news recently. Just 10 days after we heard the first bit of encouraging news in relation to the Pfizer and BioNTech vaccine proving 90% effective in trials, the Scottish Government's Health Secretary presented a comprehensive rollout plan to the Holyrood Parliament, and in that statement they confirmed the first vaccinations would be available to health and social care staff, older care home residents, those over 80 years old who live in the community. Next phase then for those over 65 and those under 65 who are at additional clinical risk, followed by the wider population of the age of 18. They hope to have 320,000 doses of that vaccine to deploy in the first 2 weeks of December, subject to regulatory approval, with an ambition to vaccinate 1 million citizens by the end of January. And the Health Secretary there said Scotland is ready for December. December's only a week away. Can the First Minister confirm that Wales too is ready? And if so, when can we expect to see details of the Welsh Government's vaccination rollout programme, including a timeline of who will be vaccinated when?
Well, on the who will be vaccinated and when, we have already said that we will follow the JCVI advice in relation to prioritisation. That advice is still being refined on the basis of the emerging evidence of which of the vaccines that are being reported are most suitable for different groups within the population. We have a very active planning group that began work back in May of this year and has met regularly throughout the crisis to make sure that we are well equipped for deploying the vaccines as they become available to us in Wales. We have tried during the whole crisis to follow this basic premise in Wales that we plan first, and when we have a plan that we think is usable and workable, then we publish it for people to see, rather than a series of ambitions which then turn out not to be deliverable, because the ambitions are inevitably founded on information which is not as reliable as you need for a purposeful plan that you can deliver in practice. When it comes to it, I doubt very much that the JCVI prioritisation list will be very different to the one that Mr Price recounted from the Scottish Government. But we will wait for a short while, and it will only be a short while, until we have that further and reliable information about the numbers of vaccines that we will have available to us, the nature of those vaccines, the priority groups to which they will be deployed, and then, of course, we will make sure that that is made public as soon as we're able to, so that people in Wales have, as I say, not a series of ambitions, but a practical plan that they can rely on.
Arweinydd y Ceidwadwyr, Paul Davies.
Diolch, Llywydd. First Minister, yesterday the Health Minister confirmed that the Welsh Government is considering tighter COVID restrictions in the run-up to Christmas. Can you confirm what restrictions you are now considering, given that you have already introduced local authority-based restrictions, hyper-local lockdown restrictions, and now national restrictions?
Well, Llywydd, the basis for what the Health Minister said yesterday is to be found in the figures. And I'm sure that the Leader of the Opposition has been following them, as I do every day. Following 2 weeks and more of figures falling on a Wales-wide basis, we've now had 3 days in a row where the Wales-wide figure has risen. And in today's figures, 17 of the 22 local authorities are reporting rises in the under 25-year-old age range. Now, numbers continue to fall in the over 60 age range, and that's good news, because in terms of impact on the health service, we know that that is where people are most likely to be most badly affected by the virus. But we also know from earlier in the autumn that the rapid rise we saw in the month of September and into October started with a rise in the younger population. So it's that background that was there when the Health Minister said what he said yesterday. And it's part of what I said to Adam Price, that I have been making the case in the meetings we've had with the other nations of the United Kingdom for a broadly aligned approach, not just for the narrow period of Christmas, but in the run-up to Christmas and in the post-Christmas period. So we have followed carefully what the UK Government has said so far this week about a return to a recalibrated tier system in England. We'll wait to have further information on that, possibly this afternoon and again on Thursday. And then this week the Cabinet will meet pretty regularly. We met yesterday, we met this morning, we'll meet again before the end of the week to see whether there are further measures that we need to introduce in Wales to focus on the nature of the rise we are seeing and which would provide us with that broad alignment with the approach being taken by other parts of the United Kingdom as part of creating that headroom we all need to allow a relaxation over the Christmas period.
I take it from that answer then, First Minister, that you are perhaps looking at the possibility of introducing some sort of tiered system here in Wales. And of course, the tiered approaches in Scotland and England do have a few differences, and it's important that the Welsh Government therefore looks at the impact of both sets of tiered-based restrictions before confirming its approach for Wales. Now, this year has been so difficult for so many, as just been said earlier, and that's why it's important that the Welsh Government makes it clear to the people of Wales exactly what a new approach will look like and how those restrictions will impact people's day-to-day lives. So perhaps you can give us an indication, First Minister, when you will be bringing forward these new measures. And can you also tell us what additional resources you will be making available to actually support these new measures and new restrictions?
Well, Llywydd, I think I've given some indications, best I can, to the Leader of the Opposition already of the decision-making path that we see in front of us, a COBRA meeting this afternoon. I agree with the point that Paul Davies made about taking account of the different approaches in Scotland as well as in England. I spoke with the First Minister of Scotland again yesterday. Then after today's meeting, there are further announcements that we will expect in the English context on Thursday of this week, we are told, which will give us a further insight into the operation of their tiered approach. I wouldn't move immediately, as the Leader of the Opposition did, to a conclusion that because we are interested in the measures that are being taken elsewhere, that necessarily means that we will be adopting a tiered approach here in England. It is the content of the measures, not simply the organisation of them, that we will be interested in. The Cabinet will meet again before the end of this week to see whether there are lessons for us to draw from what is happening elsewhere and a common approach across the United Kingdom in the lead up to the Christmas period and, importantly as well, in the way in which we will all have to deal with the inevitable consequences of a relaxation which will drive a rise of coronavirus. That is inevitable, and we need to prepare together to cope with the consequence.
Of course, it's not just individuals and families that are keen to know whether there will be any changes in restrictions in Wales. Businesses across Wales will also be undoubtedly anxious at the prospect of further restrictions. The run-up to Christmas is a busy time, of course, for businesses in all sectors, and in the wake of a very difficult year, it's understandable that many will be concerned perhaps to hear of further restrictions. It's therefore absolutely critical that resources and support are put in place in the advance of any changes so that businesses are able to plan and adjust their operations accordingly. Will you therefore confirm, First Minister, that the Welsh Government will, of course, notify businesses across Wales in advance of any new restrictions in Wales so that they have time to plan for any changes? And can you also update us on the discussions that you've had with local authorities in Wales about introducing new restrictions and what feedback you've received from local authorities so far with any potential restrictions?
Well, so I am very conscious of the impact of the decisions that we make on businesses in Wales and on people's livelihoods. The Welsh Government has put together a very considerable sum of money that we have invested in trying to protect businesses in Wales from the impact of coronavirus, that is over and above any help that has come from the UK Government. And the UK Government, with a comprehensive spending review tomorrow, needs to make sure that it is doing everything it can to make sure that businesses in Wales and across the United Kingdom are in a position to withstand the ongoing impact of coronavirus, and it needs to do it in a more wholehearted way. The repeated announcements by the Chancellor of the Exchequer of the package of assistance that comes from the UK Government has not been helpful, I think. We are doing the most we can in Wales to help businesses. I think the Chancellor's approach is to do the least he can get away with. And that is the real contrast between us. Discussions with local authorities, of course, go on all the time. There have been meetings today involving the Health Minister, the Local Government Minister, the Education Minister, the WLGA and other leaders of local authorities in Wales. And that partnership approach is the one that we think has managed to sustain us through the crisis to date, and we will be certain that in Wales we will go on being committed to it.
Question 3, McAntonev.
Will the First Minister make a statement on the impact of COVID-19 on the economy in Pontypridd and Taffili?
So I thank McAntonev for that. The latest employment and growth forecasts clearly show the damaging impact the coronavirus pandemic is having on the Welsh economy and beyond. To date, our Lockdown Business Fund has provided over £7 million in support to 2,379 businesses, spanning over 22,000 jobs in Rhondda Cynon Taf alone.
Thank you for that answer, First Minister. In my constituency of Pontypridd, we have battled with flooding, which hit our economy and our infrastructure hard. And of course, we battled with COVID, with some of the highest infection rates in the Wales. And like many thousands of others, I've stood outside my home and clapped and applauded our public sector workers as a community. And we've recognised the vital contribution that they've made during the pandemic. Many of them have suffered from COVID, some have died, and our thoughts are with the family of Mark Simmons, a healthcare assistant to the Royal Glamorgan Hospital and a Unite Health and Safety representative. He died on the 10th of November after contracting coronavirus. First Minister, all our public sector workers have gone the extra distance to keep us safe and to protect us and our families. Now, on Wednesday, whilst the Tory government's mates make millions of pounds of profit out of dodgy PPE contracts, the Chancellor Rishi Sunak is planning to tell our public sector workers that their reward for their sacrifice will be 3 years of pay freeze for tens of thousands of Welsh workers, a return to Tory austerity. First Minister, it is not too late to ask the UK government to do a U-turn. So will you make contact with the Prime Minister as a matter of urgency and do all you can to urge him to honour and recognise the contribution of all, and I emphasise all, our public sector workers during this pandemic?
Well, thank McAntonev for that, Llywyd. Thank him for reminding us, not that I know members here don't forget at all, but just for reminding us that behind everything that we talk about here are actual people's lives. Over 3,300 deaths reported in Wales by the ONS today, and many of those people have been frontline workers in our health and social care services and elsewhere. So, of course, it is not too late to urge the Chancellor of the Exchequer to rule out a public sector pay freeze and to deliver the funding across the United Kingdom that we need to protect our health jobs and to support a fair recovery. Workers across our public services have continued to play their crucial roles in the midst of a global pandemic, helping to save lives and to keep services running. They should be recognised for this effort and not forced to pick up the bill. The Chancellor says that there is no return to austerity. Well, I certainly hope that is true of public sector workers who've been at the forefront of this crisis and who deserve to be recognised for that. Unfortunately, Llywyd, I'm told that the Prime Minister will once again not attend the Cobra meeting this afternoon. You might think that given the significance of the decisions that we are having to take there, that the Prime Minister might think that that was a conversation in which he would choose to be engaged. But if an opportunity arises, there will be other ministers of the UK Government there, and if that opportunity arises, I will certainly make the points that the member has made here this afternoon.
David Melding.
First Minister, I'm particularly concerned about young people in South Wales Central, including Pontypridd, who are entering or attempting to enter the labour market during this period. And I think we have a very harsh past experience of young people entering the labour market during a period of economic distress. And I would urge you to look at the training packages and also the funds available for postgraduate study, for instance, in the next few years, because I think these sort of programmes, which are largely under the control of the Welsh Government, will need to be used to a greater extent than perhaps we had planned. But this will also help our FE colleges and the university sector. But young people really need to be supported as much as we can during this period.
Well, Llywyd, I agree with the point that David Melding is making. We have a very difficult experience in Wales of generations of young people without a future mapped out in front of them. And we absolutely do not want to go back to that in this crisis. I agree with what the member said, that there will be young people who will choose to use this period to invest further in developing their own skills and education, so that when an upturn comes, they are better equipped to take advantage of it, and we will want to help them to make sure that that happens. I know that the member will have seen the announcement on the 11th of November, where we provided further detail of the help that businesses can have, and further education colleges, of course, as a result, to promote apprenticeships here in Wales. Businesses now able to claim £3,000 for each new apprenticeship and each new apprentice under the age of 25 when employed for at least 30 hours. And I know that David Melding will particularly welcome the fact that there is an additional £1,500 for any business who is able to take on a new disabled young person as an apprentice. On the 18th of November, we announced the Business Startup Barriers Fund, a sum of £1.2 million, particularly aimed at those young people who left college and university in 2019 and 2020, who may have ideas of their own about businesses they would wish to try and get off the ground, but need that extra help and support from government in order to be able to do so. And that Business Startup Barrier Fund will particularly be aimed at the sort of young people to whom David Melding has drawn attention this afternoon.
Cwestiwn 4, Dawn Bowden.
Will the First Minister provide an update on the COVID-19 mass testing pilot in Merthyr Tydfil County Borough?
Thank the member for that. The pilot started on Saturday the 21st of November. It involves everyone living, working or studying in the area, and that they are all to be offered a COVID-19 test as part of the first mass testing of a whole area in Wales.
Thank you for that answer, First Minister, and I'm sure you'd want to join with me in thanking everyone involved in the logistics, delivery and the analysis of this mass testing programme. I went myself, thankfully, for a negative test on Saturday, and I can say that everybody involved in it has been absolutely outstanding in working to ensure that the pilot is a success, and that includes quickly updating FAQs, making sure that shielding people and people with non-shielding disabilities, elderly, frail and so on have been specially catered for throughout this process. Although we probably do still need to give a bit of thought to managing testing for those with learning disabilities, and I'd also urge you to consider probably testing in the larger workplaces as well. But in these first few days, we've seen thousands of tests taken by people who are keen to help the process, and those people with good reason to attend, and about 1% so far have been positive results from people who are asymptomatic. And over the course of that pilot, that will be several hundred people who would otherwise be unknowingly spreading the virus in the community. Now, you've already answered earlier questions about what happens after this pilot and beyond, so I won't go into those points again. But as you know, First Minister, My constituency has significant areas of poverty and deprivation, often linked to insecure work and 0 hours contracts, which, as we know, has been a deterrent to many in coming forward for testing. So can I seek your assurance that the Welsh Government will be working with local partners to ensure that mass testing is also delivered amongst these harder to reach communities, as this will be a critical factor in ensuring the success of the pilot?
Well, so I thank Dawn Bowden for that. I heard a very informative interview that she gave at the weekend, reporting from the front line of testing in Merthyr, and I absolutely agree with her about the huge team effort there has been from the local authority, from the local health board and public health services, the assistance we've had through the armed forces. It really has been a remarkable effort, and in these early days it has met with a remarkable response from residents in Merthyr Tydfil as well. Llywydd Dawn Bowden raised a number of points about, first of all, about workplaces and the importance of making sure that employers are aligned with all of this. There is an offer of a test for anybody who works in the county borough, whether they live elsewhere but work in Merthyr. A test is available from them, and I'll be discussing this at the Social Partnership Council, which is next due to meet on Thursday of this week. Dawn Bowden made an important point, Llywydd, about those people who are frail or vulnerable, shielding or with learning disabilities, and how we make sure they are included in the programme. I'm pleased to say that I believe the local authority has written out to everybody on the shielding list today, offering them a home test, which means they don't need to leave home and go to a mass testing centre. So I think that's another very strong sign of the progressive way that the testing regime is being delivered in the area. And of course, Llywydd Dawn Bowden makes the very important point about reaching those communities where conventionally services struggle the most to have the impact that we want them to make. We're going to be using wastewater surveillance methods in Merthyr, as they did in Liverpool. The wastewater surveillance, members will recall, led by Bangor University during its creation. We will have 7 different testing points in the Merthyr County Borough area, and that will allow us to see that we are getting a response in different parts of the borough, and make additional efforts in places if we're not getting the response that's needed. And as I know the local member will know, that it is part of the way in which the mass testing is being provided, that if someone does have a positive test, then they are being actively advised about the help that is available to them, either through the self-isolation payment or through the discretionary assistance fund, where we put £5 million more in to help in this way, so that people are able to do the right thing as they want to do and don't find themselves with barriers in their way that we can help them to solve.
Andrew Arty-Davies.
Thank you, First Minister, for the answers so far in the leaders' questions and also on this particular question around the trial in Merthyr. Are you in a position to confirm when the analysis can be made that if this trial is successful, and initial indications are that it has been successful, that this will be rolled out across the rest of Wales, and in particular in Rhondda, Cynon Taf, area I represent here, which I think would benefit greatly from this testing regime?
Well, I know Andrew Arty-Davies will be interested to know that RCT Council has already made a proposal for the expansion of the Merthyr testing regime into the Cynon Valley area of that local authority, and that there are meetings, I think, scheduled for tomorrow to explore that proposition and to see how it might be delivered. This is a huge logistical exercise, as I know that he will recognise, and it's why we are so very grateful to have the support of the armed forces in it, because local services have to try and manage to keep everything else they do all the time going, and releasing people to be part of the mass testing effort, requires quite a lot of thinking through. So if we are to be able to expand the Merthyr scheme into the RCT area, that will require some careful preparation, releasing local staff from local services. We have further assistance from the armed forces joining us in Merthyr over the next couple of days, and we may need to see whether there is any further help that could be forthcoming in order to assist with the sheer practicalities that go with mounting a mass testing exercise of this sort.
Question 5, Joyce Watson.
Will the First Minister provide an update on what the Welsh Government is doing to tackle vaccine misinformation?
Well, so can I thank Joyce Watson for that important question. The Welsh Government will continue to support health boards and Public Health Wales to ensure that immunisation information is accurate and accessible, and all those delivering vaccinations are well trained and confident when providing immunisation information.
I thank you for that, First Minister. Last week, Pfizer and BioNTech announced that they had developed a vaccine for COVID-19 and that it was showing promising results. But almost immediately, there were messages circulating on social media channels suggesting that the vaccine would be harmful without any substantiated evidence. I understand that it's natural that people will have concerns and questions about the safety of new and existing vaccines, but I do believe that the misinformation that we've seen on social media platforms has the potential to do a significant amount of harm. Minister, what discussions has the Welsh Government had with social media channels regarding vaccine misinformation and how we can tackle that? And what steps are being taken to encourage people to access information in a reliable format?
Well, thank Joyce Watson for those follow-up questions. She's right to point to the danger of vaccine misinformation, deliberate malicious misinformation. It's part of a group of attitudes that unfortunately have been given credence in other parts of the world. You know, these attitudes emanate from the same group of people who are coronavirus deniers, who try and persuade people to distrust election results, and as a result they have a reach into places through social media that could, if things went wrong, do what Joyce Watson said and discourage people who would benefit from vaccination from coming forward. We work with the Cabinet Office in London. They have a rapid response unit which is expressly there to respond to coronavirus misinformation. And working with social media platforms, there's been some success, which I'm keen to recognise, in persuading those social media platforms to remove misinformation where it can clearly be identified as such. I think we have to take some comfort, though, Llywyd, from the actual evidence of what has happened in vaccination programmes over the last period. We have actually gained ground in childhood immunisation programmes during the period of the pandemic. The uptake of the first dose of MMR increased in the first quarter of this year, despite all the difficulties that parents would have experienced in trying to present the child for vaccination. The third scheduled dose of meningococcal group B vaccination is at the highest ever level in Wales. And of course, we are reaching more people with flu vaccination than ever before. 70% of people in the over 60 age group have now been vaccinated. It was under 60% this time last year. 37% of under 65s at risk have been vaccinated. It was 27% this time last year. 73% of children aged between 4 and 10 have been vaccinated. So while I share the members' anxieties, the actual behaviour of people in Wales suggests that when a vaccine is available to them and they have confidence in it, they are coming forward in large numbers, and that's what we will want to encourage when there are vaccines available for coronavirus as well.
Angela Burns.
Thank you, Clara. First Minister, I do agree with you that there have been improvements in vaccine uptake, but I'd also like to point out that according to the most recent seasonal influenza Wales 2020 annual report, the uptake of flu vaccine amongst NHS staff was only 56% this year. And when you think that NHS staff, more than almost anybody else, would surely really understand the value of a vaccine and what benefits that we can all get from it. We've also got our very hard to reach people, the people who speak neither Welsh nor English, people who are new to our country, people in very, very marginalised areas, or people in very rural areas where, again, that whole notion of coming out, getting vaccinated, plus the vaccine for COVID needs to be a two vaccine stop. Where you might have a situation where someone has one and just thinks, oh, well, that's it, I'm done, when in fact they need that second one to make sure that they are really taken care of. So I wonder what plans the government will be putting together, either as Wales itself or as a UK entity, in trying to really get a strong message out that actually there is nothing to be fearful of. And may I just very quickly also say that that we must be very careful how we do that messaging, because, you know, I speak as a parent whose first child had all the MMRs individually because Andrew Wakefield was at the height of his scarefest, and my second child had just the MMR, because just normal, ordinary people can take fright very easily when all the wrong messages go out. So I think it's incredibly important that we put together a really cohesive and coherent communication policy, and I would be very interested to know what your government is doing to put that together, and indeed how all of us might be able to help to spread that message.
Well, thank the member for that. I agree with Angela Burns that the percentage of NHS staff taking up a flu vaccination last year was not good enough. It was better than previous years. And I remember many discussions with Darren Miller here in this chamber when I was the Health Minister and he was the health spokesperson about the extent to which we could insist and require that staff take up vaccination. Now, the good news is that the numbers are well above where they were last year at this point. So the improvements that we've seen in the general population are reflected in healthcare staff as well. But I believe they have a professional obligation to protect themselves from the risk that they otherwise pose to those people who use their service. So for those staff, it is not just a matter of protecting yourself. It is a professional obligation, I always argued, to make sure that you avoid a risk which otherwise you may pose to others. And we need to do more. We need to do it with the Royal Colleges, with the trades unions in that field to drive that figure up even further. I was reminded in Angela Burns' supplementary, Llywydd, that when we saw the measles outbreak in Swansea some years ago, the families we failed to reach were not families, in fact, who were avoiding vaccination. They were the families that Angela Burns referred to, people whose first language is neither Welsh nor English, who are mobile and whose addresses change rapidly and where conventional ways of reaching them don't work. But I do think Public Health Wales learned a lot from that experience, and we're better equipped now to make sure that we can respond to those difficulties. And finally, can I just agree with the final point that Angela Burns made, Chloe, that we need the effort that can be made by all of us. Every member of this Senedd has some standing in their local communities. We all speak with some authority to groups within our own areas, and it's adding our own voices, as well as that of public services, to that global effort we will need when a vaccine becomes available to persuade people of its safety, of its efficacy, and of the very many good reasons there will be why people should come forward to receive it.
Helen Merrick-Jones.
Diolch, Llywydd. I'm grateful to Joyce for tabling this very important question. First Minister, it's not only online that misinformation about COVID is being shared. It was drawn to my attention last week of a particularly pernicious leaflet being put through people's doors. It was in Pembrokeshire, but I was also made aware that it was happening in Caerphilly. It had an official look about it. You could have mistaken it for an official government communication. Now, misinformation, I think, First Minister, online is bad enough, but at least people have got some sort sort of choice about what Facebook groups they join, what Twitter feeds they follow. This leaflet was coming through everybody's doors without them having any right to reject it. Is there any, I mean, I think we all in this chamber support freedom of speech, but freedom of speech needs to be exercised responsibly. Is there anything further the Welsh Government can do, working with the police service in the areas that have been affected by this leaflet, with local authorities, to try and counteract this message? And is there any legal redress against people who are deliberately sharing information that could be very frightening to people and very, very damaging, and as we've already touched on around areas like persuading people to take up the vaccination?
Llywydd, I think Kelly Nugent is right. There's something particularly insidious about something being put through your own door, and that deliberate and, as I would say, malicious attempt to mislead people with inaccurate information. I know that local people who've received that leaflet in Pembrokeshire have inform the police and look to see whether there is any redress. It's the same leaflet, as I understand it, has been in circulation in many parts, not just of Wales, but more widely. Amongst the things we can do are the things that Angela Burns referred to, which is to mobilise voices that will carry some weight in local communities. And I know that tomorrow evening, Steve Moore, as the Chief Executive of Hywel Dda Health Board, and the Police and Crime Commissioner for the area are jointly holding a Facebook Live session, partly in response to the circulation of that leaflet, so that they can be together in providing authoritative information to the local population and to do it directly in that way.
Question 6, David Melding.
Excuse me. Will the First Minister make a statement on the estimated number of rough sleepers in Wales?
Thank you. Latest estimates suggest that during the month of August, 974 people presenting as homeless were found immediate accommodation. 476 homeless people were provided with suitable long-term accommodation, and 101 homeless people were rough sleeping. Monthly data of that sort will be published for the remainder of this Senedd term.
Can I thank the First Minister for his answer? And he would have also heard the exchange in the Chamber last week with the Housing Minister. And the number of 100 or 101 rough sleepers who are now on the streets of the towns and cities of Wales is very distressing. Now, I know over 3,000 or 3,500, I think, people have been helped during COVID into emergency accommodation of one kind or another. And that is a real achievement. But part of the problem is that for many years we've not had a very reliable estimate on the number of rough sleepers, and this has been a problem across the United Kingdom. But we do need to know the level of the problem so that we can take appropriate action to meet the scale of it. But can you give us the assurance immediately that the assertive outreach to help those 101 people rough sleeping at the moment is being effective?
So I think we can give that assurance. It's two things together, it seems to me. It is assertive outreach, and then it's a proper level of support for those people after they have been reached and after they have been placed in accommodation. We know that amongst the 101 people who were sleeping rough in August, there will be some people whose level of addiction to alcohol or to drugs has taken them back onto the streets again. We will know that in some settings where people who were previously homeless have been temporarily housed, there is a level of antisocial behaviour that has an impact on staff and of other tenants alike, and which some people find they're just not able to deal with. So, as well as reaching people through assertive outreach services, we also have to make sure that we have the help that is then necessary to sustain people in temporary accommodation to begin with, and then into permanent accommodation in the way that we wish to see. And I know that David Melding will be aware of the fact that in the £50 million next phase of our homelessness response, nearly 10 million of that is for that wraparound support in mental health and substance misuse, to try and make sure that people do not feel that the answer that's right for them is a return to rough sleeping from which they otherwise would have been relieved.
Cwestiwn 7 yw i'r Anca Davies.
Diolch, Llywydd. What action is the Welsh Government taking to ensure that it can create jobs and training opportunities for people of all ages in Ogmore in the context of an economic downturn?
Llywydd, in July, we announced a £40 million package to help employers across Wales to take on and train new workers. Earlier this month, as part of that package, we launched specific assistance to encourage recruitment of apprentices, as well as a barriers fund to help individuals who are considering self-employment.
Thank you for that answer, First Minister. And First Minister, you'll know that Centrica began talks with the GMB union earlier this year about terms and conditions changes to jobs, but they kicked off those talks in the middle of a pandemic with the threat to fire and rehire its 20,000 strong UK workforce. And the biggest proportion of these jobs per head of population is right here in Wales, and many indeed are in my constituency. Now, this is a company, First Minister, which has benefited from a £200 million contract to run the Nest energy efficiency programme in Wales. So do you agree with me that this is not what we should expect from an organisation with which we do business here in Wales? It's not the way we expect them to treat its workers. And will he therefore call on them to take their threats off the table, come back from the brink, and work for a sensible negotiated deal that is in the shared interest of the reputation of Centrica plc and their shareholders, and most importantly, in the interest of their highly skilled and loyal workforce and their families?
Well, Llywydd, I certainly am aware of the Centrica issue, having had discussions directly with leaders of the GMB about it, and my colleague Ken Skates wrote to Centrica back in August when we were last discussing this with the union. Let me be clear, Llywydd, there is no excuse for any organisation or company using the coronavirus crisis to erode the rights and the entitlements of its workforce. And I echo very much the final point that Hugh Anca Davies made. I think the company would be very well advised to take the threat off the table, to get back around the table, and to work with the GMB to a negotiated deal.
Canola, question 8, Sian.
Finally, question 8, Sian Gwenllian. Thank you, Llywydd. Will the First Minister make a statement on dental services in Arfon?
Thank you very much, Sian Gwenllian, for that question. Betsy Cadwallader University Health Board is working to improve access to dental services. This includes plans to urgently replace lost provision and to have interim measures in place to maintain the continuity of care.
I understand that there will be a training centre for dentistry opened in North Wales, and that's very good news, but it is 2 or 3 years away. And in the meantime, there is a very real crisis developing in my constituency. And part of the problem arises from the way in which the contracts work between dentists and the health board, and there has been a pledge for some time that this government would look in detail at what needs to be done in order to improve that situation. Can you make progress with that work now, please? At the moment, people in my constituency are being let down. There is another dental surgery to close next year, and it truly requires urgent action in this area.
Well, Llywydd, may I say thank you very much to Sian Gwenllian, and I've seen from the figures what has been occurring in her area. We haven't mentioned Brexit yet today, Llywydd, but Brexit has had a negative impact on dental services. 17% of dentists employed by the major companies, and the major companies are the ones that are withdrawing from areas such as the Northwest. They are recruited from, the dentists are recruited from the European Union, and Brexit undermines that. Well, as Sian Gwenllian was saying, the new dentistry unit in Bangor will assist, and the health board's efforts to increase access to emergency dental services will help. And Professor Paul Brocklehurst, the Deputy Chief Dental Officer, is located and based in North Wales, and he will be offering special support in responding to the challenge that is being faced in the members' constituency.
Yr eitem nesaf felly.
Thank you to the First Minister. The next item is questions to the Council